You went through menopause 2 years back, but recently you noticed bleeding again from down below. You wonder if this is normal. Should you celebrate or should you worry? And that's what we're going to talk about today, which is postmenopausal bleeding. We learn what to do and also what not to do during this time. Stay on this video and learn all you can about postmenopausal bleeding. Assalamu alaikum sisters. Welcome to my channel. And if you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revert Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more energy, focus and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our deen. So if you are in this phase of your life, then join me and let's make this journey together. In a recent group coaching session, one of the sisters asked me this question. She said, I went through the menopause 2 years back and I have started getting periods again. I'm 52 years of age. The periods are not heavy. Is this okay or do I need to do something about it? Now this is not uncommon, and if you are in the same boat or experiencing something similar, I would suggest you need to go and see your doctor straight away. What this sister was experiencing is postmenopausal bleeding. If you have been through menopause and you are over the age of 45 and you've stopped having periods for at least a year or 12 months, and then you start bleeding again, this is called postmenopausal bleeding. It's important to remember that postmenopausal bleeding always needs to be followed up and investigated. And you cannot adopt a wait and watch approach. Why do I say so? Postmenopausal bleeding is not always serious, but can be a sign of cancer. And cancer is easier to treat if it is found early. What are the causes of postmenopausal bleeding? They could be thinning of the lining of the womb and the vaginal tissues because of low estrogen, and this can cause bleeding. They could be polyps or outgrowths from the neck of the womb. There could be an overgrowth of the lining of the womb itself, which could be either non-cancerous, it could be precancerous, or it could be cancerous. And 10% can be because of cancer. It could be a side effect of HRT. So whether you experience postmenopausal bleeding, heavy or a little amount, it doesn't really matter. You need to see your doctor straight away. What your doctor would do is an examination which is like a speculum examination when you have a smear test done, just to make sure that there is nothing going on and that could be causing the bleeding. And if there is thinning of the vaginal tissues, as we talked about, then sometimes your doctor would prescribe estrogen cream, and this can strengthen the vaginal tissue, and over a period of time, as the vaginal tissue strengthens, you can stop bleeding. If your doctor notices any polyps, which is outgrowths from the neck of the womb or womb, generally these can be removed in an office setting if they're small, or sometimes you may need a short operative procedure where you would need anesthesia to remove the polyps, but this is a very minor procedure. An ultrasound scan is always performed to make sure that there is nothing going on inside the womb. And depending on what your doctor finds on ultrasound, it is quite common to do an endometrial biopsy, or taking a small piece of tissue from inside the womb and examining it under the microscope to make sure that there is no overgrowth of the lining of the womb, whether precancerous, non-cancerous or cancerous. and the treatment will depend on the result of the biopsy. Sometimes if you are on hormone replacement therapy, then this can cause bleeding, and what your doctor would do is adjust the hormone replacement therapy or change the tablets so that the bleeding is controlled. Now, if you are wondering, is HRT for me? I talk about this in my free workshop, Hormonewise, where I talk extensively about perimenopause and menopause and give you a balanced view on the pros and cons of HRT. The link to register for the workshop is in the description below. So this is a brief overview of postmenopausal bleeding and how your doctor would go about investigating and what you can expect. The bottom line is that if you do experience any kind of bleeding after having been through the menopause, so 12 months of not having any periods, don't wait. Just make sure that you go and see your doctor, because it's always best to be safe rather than sorry. If you have postmenopausal bleeding, your doctor will always ask for an ultrasound of the pelvis. Now, as we've already talked about, it can help to detect growths like polyps or fibroids. One of the main things that your doctor is looking for is something quite surprising. Before we talk about that, if you found this video beneficial, please like and share, and subscribe to my channel, as this will help me reach out to more sisters who might need my assistance. Share the barakah and have a share in the barakah. So, one of the key information your ultrasound will show is endometrial thickness, or the thickness of the lining of the womb. This will determine what are the further steps your doctor will take. Watch my next video to learn why this is so. Jazakumullah khairan for watching, and I'll see you on my next video. And remember, your best is yet to come.